Good afternoon and welcome to the 175th of the COVID calls. This is a daily discussion of the COVID 19 pandemic with a diverse collection of disaster experts. My name is Scott Gabriel Knowles. I'm a historian of disasters at Drexel University in Philadelphia. Today, we have a discussion of COVID 19 and the technology of response in Asia with Yansil Kang and Hallam Stevens. Just a reminder, you can catch COVID Calls live every weekday at 5 p.m. Eastern Time on YouTube. Just go to the COVID Calls YouTube channel to watch. You can also watch COVID Calls on Facebook Live and on Periscope. You can hear COVID Calls anytime, recorded as podcasts on Spotify, iTunes, Podbean, or anywhere you get podcasts. You can also keep up with COVID Calls via Twitter using the handle @US of Disaster or @COVID Calls. Please help spread the word and send suggestions for future guests and future topics. And please feel free to suggest yourself as a future guest. And just a special thanks. People have been sending really excellent suggestions for future guests and topics, and I do appreciate that. Please keep those coming. You can reach out to me on Twitter or you can email me directly at sgk23@drexel.edu. Love to hear from you. As of today, November 24th, 2020, there are 1,403,513 deaths from COVID 19 globally, according to the Johns Hopkins University Coronavirus Resource Center. There are 12,448,099 cases in the United States, and there are now a total of 258,364 deaths from COVID 19 reported in the United States. In Singapore, there have been 58,183 cases with 28 deaths. And in South Korea, 31,353 cases reported with 510 deaths. As a way to bring some humanity to the numbers, I've been reading a life story or a story of advocacy for those impacted by the pandemic in some way. I'd like to continue that now. The headline is COVID 19 deluge overwhelms South Korea's delivery drivers. I'm so exhausted. This appeared in the Wall Street Journal yesterday, the 23rd of November, by Dasel Yoon. In the final days of his life, Kim Dong-hee had worked nearly 24 hours straight, delivering packages around Seoul, and still had a quarter of a truck left to unload. I'm so exhausted, he told a coworker at 4:28 a.m. in a text message last month. Days later, Mr. Kim, 36 years old, was found dead at home because of heart failure. Mr. Kim is one of 15 delivery drivers who have died in South Korea this year, prompting calls for more worker protections in the industry. South Korean President Moon Jae-in has urged action to protect delivery workers who exist, quote, in the blind spot of our system, unquote. This month, the country's employment minister proposed sweeping changes, such as halting daily deliveries at 10 p.m. rather than offering them round the clock and implementing a 5-day work week. The pandemic-fueled shift to online buying has exacted a human toll on the world's delivery workers. Orders have surged 50% in Europe, 70% in Asia Pacific, and 120% in North America year over year, according to a July report from the Organization for Economic Cooperation and Development. Drivers have gone on strike in the United States, the UK, Italy, Spain, and China. In the US, Amazon.com hired rescue drivers to deal with the uptick in demand, while others added thousands of jobs. Workers won increased health and safety benefits in the UK and formal work contracts in Spain. Delivery workers are particularly vulnerable in South Korea, where they are classified as independent contractors rather than full-time employees, meaning they lack guaranteed break time, caps on work hours, or compensation if injured on the job. The typical South Korean delivery driver works between 13 hours and 16 hours a day, without overtime pay or compensation for loading trucks with parcels that can take up to a third of their shift, according to the Tekbe Union, a labor group that has been advocating on their behalf. They are fined by the agencies that employ them if deliveries are late. Compensation is on a per parcel basis at 70 cents a package. The pandemic has created a perfect storm for delivery work and exposed poor conditions that had been lurking beneath the surface, said Jake Wilson, a sociology professor at California State University Long Beach, who co-edited a book on Amazon's delivery workforce. In the case of South Korean delivery workers, Mr. Wilson said, it demonstrates how the industry has really raced to the bottom of worker protection. Among wealthier countries, South Korea logs more work hours than every OECD country except Mexico and Costa Rica. Mr. Moon made work life balance a priority, promising citizens a right to rest, and in 2018 lowered the maximum work week by 16 hours to 52 hours, a restriction that doesn't apply to delivery drivers because they are independent contractors. It is unclear whether the working conditions were factors in the deaths of the 15 delivery drivers that the labor group has attributed to overwork. Under South Korean labor standards, deaths can be attributed to overwork if the individual logged more than 60 hours each week for 3 months before they died. But it is a distinction without a legal or medical standing. Standing at 6 feet 3 inches and weighing 260 pounds, Mr. Kim had no underlying conditions when he collapsed, said his brother Kim Dong-kyu. An initial autopsy showed Kim Dong-hee had died of a heart attack, his brother said. Family members of other delivery workers who have died say logistics firms have disputed that overwork led to the deaths, saying the workers had underlying conditions or that they delivered fewer parcels than reported. The families deny those assertions. CJ Logistics Corporation and Hanjin Transportation Company, two of the country's largest logistics firms, have made public apologies over the deaths of workers during the pandemic. CJ Logistics has said it would hire 4,000 new workers to reduce the amount of unpaid work drivers face sorting packages. Hanjin will halt nighttime delivery shifts starting this month. Hanjin made a public apology over Mr. Kim's death last month, vowing to seek ways to reduce the workload and improve working conditions. We will try our best so that such a tragic incident doesn't happen again, Hanjin said. In recent months, South Korea's delivery drivers have gone on strike, hoisting signs that read, "We want to live." While customers benefit from express deliveries, workers are dying. Low delivery costs and increased parcel volumes result in couriers taking on impossible loads to maintain their job, said Jin Kyung-ho, a union leader who represents family members of the deceased workers. Kim Dong-kyu said that in late October, he met officials from Hanjin, where his brother had worked for more than a year. Hanjin officials apologized for the death of his brother and promised compensation, he said. They had disputed whether he died from overwork. They apologized as a formality, Mr. Kim said. Days after sending the message to the co-worker saying he was exhausted, Mr. Kim didn't report to work. Friends found his truck parked outside his home. They called his phone and heard it ringing inside his apartment. A locksmith opened the door and Mr. Kim's friends found him dead inside. At Mr. Kim's funeral last month, his 5-year-old niece noticed family members gathered in front of her uncle's photograph and asked whether it was his birthday. No one could tell her she wouldn't see him again, Kim Dong-kyu said. All I'm left with are text messages on his phone that say, "Delivery complete," he said. Okay, let's turn to our conversation for today. Really glad to bring my guests on and introduce them. Let me introduce first Yeonsil Kang, who maybe needs no introduction if you've been following COVID Calls. This is Yeonsil's third visit to COVID Calls. I'm really happy to bring her back. Yeonsil Kang is currently a visiting assistant professor at Drexel University in the history department. She's interested in understanding the intersection of the environment, science and technology, and disasters, especially in East Asia. She's working on a project, Mineral Time, Bodily Time, Asbestos, Slow Disaster, and Toxic Politics in South Korea, which explores the history and politics of asbestos, the environmental hazard that shaped environmental health policies in South Korea. My second guest today is Hallam Stevens. He's an associate professor of history at Nanyang Technological University, Singapore. His work focuses on the history of technology, particularly in the domains of the life sciences and information technology. He's the author of Life Out of Sequence, a data-driven history of bioinformatics, which appeared with the University of Chicago Press in 2013, and Biotechnology and Society, an introduction, which also appeared with Chicago in 2016. He's also co-editor of Postgenomics, Perspectives on Biology After the Genome, which appeared in 2015. He's currently the head of the history program at Nanyang, and he also holds appointments as the associate chair for research in the School of Humanities and the associate director of the Nanyang Technological University Institute. Hallam Stevens and Yeonsil Kang, thank you so much for joining me on COVID Calls today.
Hi, thank you for inviting.
Yeah, hi. Thanks for having me.
And I do have to award, it's not a cash award, I'm sorry to say, but I do award people who stay up very late or get up extremely early to come on COVID calls. Hallam, what time is it there?
It's just after 6 a.m. So
That's some COVID calls dedication there. Really appreciated. Let me ask you first. So you're all calling, but maybe you can tell us a little bit more. Calling from Singapore, what's the pandemic situation there today?
the pandemic situation here is very, very stable. It has been for quite a while. I believe that there have been no cases reported in Singapore for maybe about 20 days or something like that, with the exception of cases that have been imported into the country from outside. So people who've arrived at the airport, but those people have been placed into quarantine in any case, so they haven't spread it further within the Singapore population. So things are very, very safe, very, very stable here. In fact, there's not much to worry about at the moment in terms of coronavirus.
It's very hard for me to relate to that reality. I mean, can you even get a front page headline in Singapore about the coronavirus?
Yeah, I mean, a lot is still happening. There's still a lot of restrictions here, and I'm sure we'll get into why that is. And certainly, I mean, really now the big question is the economy, actually, and the Singapore economy depends on trade. It's a huge transshipment port. It's an international hub for people and goods, and all of that has been shut off. And so now the problem is how to reopen, and that's a big issue. And so a lot of the headlines sort of are really around that, right? How do you reopen? What steps are being taken? What steps can be taken towards that? Because the economy has shrunk massively. I think I saw something like 42% in the second quarter or something like this. So it's a huge, huge blow.
That's a tension. I know we'll talk about it as we go, but it's not only the experience of Singapore, but other countries that have managed the pandemic well. But the infection rate and the death rate is only one part of this disaster.
Right.
And so, well, okay, I look forward to hearing more about that. Yansil, let me ask you where you're calling from and how it's looking there.
All right, I'm calling from Philadelphia, and just like many other cities, states in the United States, Philadelphia and Pennsylvania have been experiencing uptick of the confirmed cases. So as of last Friday, November 20th, the regulation has been strengthened. So including high schools, colleges going online, indoor dining is banned, and all sort of indoor entertainment, indoor exercising is banned, including museums. And interestingly, Pennsylvania just banned alcohol sales on the Thanksgiving Eve until the Thanksgiving morning, which I learned that is one of the largest party night in the United States. So they just banned it just for the sake of preventing any further surge of cases. But what I observed last weekend is that Philadelphia city center is very much crowded. Restaurants are filled with people dining outside, which seems like dining outside is no more a temporary measure, but it looks more like with the heaters, with the tents, it looks more like a permanent setting now. And then they blocked certain roads to install tables and stuff. So it's a bit concerning, considering that they just strengthened the regulation. People doesn't seem to be bothered to gather outside, dine outside, and then that was something surprising to me.
The point of being outside is that
on the
particles disperse themselves, and the weather gets below 65 degrees, and you build a structure around the outside dining.
True. And then they have heater, and then it's the level of the density of people around that area doesn't seemed to be quite safe. Although we assume that the air is blowing and it has much better circulation than the indoor spaces, but still, it didn't look very safe for me. So that's what I've observed. And just briefly for South Korean, and it's also increasing, and it's local. Unlike Singapore, it's local infection, local clusters that worries South Korean government. And another concern is that there is a national college entrance exam coming early December with 490,000 students and large amount of teachers who administers that for one day. And it's a very challenging task to administer, and it's the test every high school students are looking for, and even airplane does not land for this 25 minutes of the English listening test time. So the pressure, how the entire nation is holding their breath for the day. So it's a very challenging task, and then they are trying best, but we'll see how it will go.
It's amazing. So they're going to basically take on the largest social distancing exercise that they've tried yet in South Korea throughout this pandemic.
Yes, I would say it's much challenging than having a general election during the pandemic.
I want to make sure people know also that, Yeonsil, you were part of a discussion. It's episode number 157, if people are looking for it, on October 27th, Life in Quarantine, also with Aram Jung and Hilda Vandenbulk that day, so you have the real perspective of South Korea and the United States in terms of, just even hearing you describe what sounds the way you described it, the sort of intolerable risk of everybody sitting outdoors and eating inside enclosed spaces. Americans, many of whom who I think are trying to be very careful, have looked at that and said, okay, well, that seems fine. So you have a very unique perspective, going from one culture where many of the risks that we're adopting in the US are intolerable, I think, in South Korea, and vice versa.
Yeah. The level of the sense to the numbers, sense to the confirmed cases is totally different. We have, South Korea, for example, had just above 300 confirmed cases per day last few days. And then whole country went, crazy. And then they increased the level of social distancing to the second level, which is the mid, which is pretty harsh level. You limit the gathering. You're not supposed to have more than, I guess, 50-person gathering indoors. So that's pretty harsh. A lot of my friends who planned wedding had to postpone multiple times, just to fit in all the guests in one place. And so you see the different sense of risk going on there. And then just a few days ago, I had a call with my parents, and then they were surprised to hear that it's every minute or so a person is dying of COVID-19 in the United States. That was I think yesterday's news. They can't even imagine why that is happening, to be honest. And it's simply a puzzle for them. How could the system let that happen? So I would say it's a totally different sense of risk going there. And then what is considered to be risky is a bit different. I shall talk more, but so is the responsible behaviors. And what are responsible behavior? The idea of responsible behavior and trust to each other is totally different, I guess.
Yeah. It's amazing what, this is disaster research in general, that we find out about disaster, but we also find out a lot about cultural sort of perspectives around risk and risk toleration and the sort of broader political economy more generally. Hallam, let me bring that back to you. Maybe you can give us just a condensed version of how the pandemic sort of emerged on the scene in Singapore, what the government's initial reaction was, and then I want to really hear kind of your analysis of the technological side of that. What kinds of technologies were brought to bear on understanding, surveilling, and managing the pandemic from the Singaporean perspective?
Yeah. So, I mean, perhaps it's helpful to give a little bit of sort of very basic context. So Singapore is a very, very small island. The land area is about the size of kind of the 5 Manhattan boroughs, like stuck together. You can take a subway from the airport, which is on one end of the island, to my university, which is on the other end. It takes about an hour and a half sitting on the subway. So you can get a sense of how small it really is, and consequently, you know, a sense of vulnerability as well, I think, around, because of its size. It's quite dense. There's 5.5 million people living here. About 70% of the population are ethnic Chinese. So that, apart from geographical proximity, this also means that there are close, for example, business ties to China. And so this was obviously consequential for the pandemic, because there were, you know, already in January, so I remember around Chinese New Year, which was the end of January earlier this year, this was already, people were very aware of this, people were aware of coronavirus and knew that it was a problem. And so the government reacted very, very swiftly, partly because they knew that there were a lot of travelers from China in Singapore who could be spreading the virus. And so they did a number of things. They implemented quarantines for travelers. In some cases, closed the borders. They issued masks to everybody. At first, we were told, in fact, not to wear the masks unless we were sick, but they did issue them. We could pick them up at our kind of local community center here. Also, I think the kind of centerpiece really of Singapore's response has been really, really rapid contact tracing. So really putting to work a group of people from the government who could very, very rapidly track down where people had been. So this was first done by interview. So if you arrived at the airport and you subsequently were diagnosed with COVID, they would interview you and say, where have you been? And this was then corroborated with ATM records, credit card records, taxi records, hotel records. So a very elaborate system of both kind of technological, but also kind of interview-based contact tracing. And that worked. It seemed to work very, very well. And Singapore seemed to, I mean, there were cases spreading. We're talking about February and March here, but it seemed to be getting things relatively under control. I think the contact tracing time was about 4 days. They got it down to about 4 days. So they really had the aim of getting what they called the complete graph, right? So basically the list of everybody that somebody had contact with, and then placing all of those people on either quarantine or what's also called here stay home notice, right? So you're instructed to kind of stay home and not go out for any reason, and obviously there are kind of punishments associated with that, with violating those rules as well. So that's the kind of basic aspects of the response. The sort of technology stuff, I mean, basically this is something I've kind of written about a little bit, but so this has now been, I mean, basically the main kind of technological responses have been to kind of supplement contact tracing, or to sort of tech up contact tracing in some ways, with specifically apps. So we all in Singapore now have an app on our phone called Safe Entry, which is tied to our kind of national identification number. And whenever you go into a mall, a cinema, a restaurant, a shop, you need to scan a barcode, and this basically then says that you've been there. And the idea is that if somebody else has been in that shop at roughly the same time, who is then diagnosed or is then tested positive with the coronavirus, they will contact, the Ministry of Health will contact me and say you need to get tested, or you need to go into stay home notice, or potentially into quarantine. So that's Safe Entry. And then there's also an app called Trace Together, which is something that operates on Bluetooth. And this is not about location, but about tracking your close associations. So basically the idea is if you have the app on your phone, which the government has strongly encouraged, then it exchanges, if you're nearby somebody, it's roughly about 10 meters. What's that in? It's like, something like 20 feet, right? 16, 20 feet. Then you exchange a Bluetooth ID with that other person's phone. And it stores a record in your phone of all the people that you've been in sort of close association with. And the idea, again, is if you were, for example, tested positive for coronavirus, then the Ministry of Health would ask you to upload the data from your phone, which would give them a list of the people you've been nearby for the past 3 weeks. And that would then be used to alert them and to facilitate the process of contact tracing.
Now, I mean, for someone like myself who's in the United States, I'm in New Jersey, we're not out much. I go for a run in the woods. I might go to the grocery store. If I used Trace Together, then that might be, could be a couple dozen people maybe. But you're in Singapore where things right now, I mean, I know there's restrictions, but if you're in a hotel or moving through a mall or down the street, I mean, doesn't that have the potential that there could be hundreds or thousands of people involved in that?
Absolutely. Yeah. In fact, it tells me on my app how many people I've kind of contacted, and the number is, for a normal day of moving around, not a day where I work from home, for example, but a day where I might go to a few shops or go and eat in a restaurant. The number is in the thousands. So yeah, it's potentially a huge amount of data, a vast amount of data. There's a little bit of ambiguity around the timing here. So at first, the idea was that it would ping other phones, I guess, every kind of minute or so, and you would have to be in proximity for something like 15 minutes at least before it would kind of before it would sort of exchange the IDs in a permanent way. That seems to have kind of changed, because there's no way that I'm around thousands of people for that amount of time every day, right? Certainly. So yeah, there certainly seems to be, they're tweaking. I think they're tweaking a little bit how this works, and yeah. But there's also a sense of time right here. It depends how long you've been in contact with people.
Can I interrupt just briefly? I didn't watch the whole entire season, but it kind of reminds me of this diasporic version of one of the Black Mirror episodes. Like there's a dating app installed in each other's phone, and then if they find a match within proximity and they ping their phones, and then they kind of connect it. But it's the pandemic version of, it seems like.
Yeah, it's sort of like the opposite of attraction, though, right? And if you want to stay away from the people who might have coronavirus,
right?
Though,
right? Right. My phone is now full of contact information for people who I want to stay away from. But it's. Right. Well, I have a lot of questions. But let me just put a pin in that for a second, because I want to hear more about how people reacted to it. Both. I mean, the numbers. I mean, if you sketch out a causality here, the 28 people having died of COVID-19 in Singapore, even for a very small country, is just astounding. Yeah. And so, I mean, on the one hand, if you say, well, the causality here is clear. I mean, maybe these apps are gathering a lot of data, and it's demanding a lot of people to want to share that information. But look at the result. I'm not sure that's a good causality. Is the government sort of leaning on that and saying this is why we have this level of success?
To some more, I would say that there's a lot of complexity here. In fact, I think that some of the reasons for the very low numbers of deaths have to do with, well, it certainly has to do with the medical system, right? The medical care is at a very high level, and there's no doubt that people who have been sick have received the attention that they need, and that's part of the story here. I also think that a lot of the contact tracing was happening before Trace Together, before these apps even really emerged. I mean, they emerged very quickly, but still, I think a lot of the kind of manual contact tracing, if you want to call it that, even though it did have some kind of technological components to it, was actually working very, very well before any of these apps were in place. So I think that the messaging around these apps now has become more about improving contact tracing even further, but also maintaining vigilance, right? So we need to maintain vigilance, and especially in order to open up, to reopen the economy and to reopen to travel. I think that's a big part. Obviously, as I mentioned, that's a huge challenge for Singapore right now, how to reopen. And in order to do that, at least the government is saying, well, we need these apps in order to be able to do that. And in fact, the government has almost, I think it's pretty explicit. They've said, unless a certain number of people, they're saying something like 2/3 of the population downloads the apps, we basically won't lift certain kinds of restrictions, social distancing kind of restrictions. So there's a little bit of a kind of carrot argument, right? If you download the app and you comply, then we will lift some of the restrictions on movement, including potentially on international travel.
Jansel, I want to bring you in on South Korea just a second, but I want to just point to this question from Jacob Steer Williams, who's asking, I think this is a great question, to think a little bit about the historical preconditions that make this kind of, not only the technology possible, but the compliance part. And Singapore, my depth of knowledge of Singapore's history is not too deep, but I mean, this is a country that's had, it's been a colony twice in the last 75 years. So there's a precondition there of understanding the evolution of public health system.
Right.
And then it's had its own independence from Britain since what, 1960s?
It's complicated. It was independent in 1957, but then it was part of Malaysia for a while, and then kicked out, and finally got its independence fully in 1965. So, but yeah, there's a lot to say about this question. The colonial history of public health, certainly. But also one could think about the history of SARS here in sort of 2003. This impacted Singapore in a bigger way than it did. It was more significant than it was in the West, certainly. So there was some kind of preparation, sort of institutionally, I think, as well as perhaps kind of culturally, I think, for this kind of pandemic. And then I also, I think the biggest thing that stands out to me here is kind of the post-independence way in which the country has been kind of managed as well, which is a kind of, one of the things you could say about that is that there is a kind of large dependence on, or large kind of stock put in technology in general, right? That in fact, at least since the 1980s, Singapore has become a kind of very modern, kind of tech advanced society, and thinks of itself as that way. And I would even say that a great deal of the government's kind of legitimacy is based on the idea that they have delivered. I imagine there's some similar things to be said about South Korea. They have delivered a kind of, for example, a world-class subway system, right? That is sort of an example of what the government has provided kind of technologically for the people. So I think this idea that technology can solve problems, and technology should be a part of the kind of response, and should play a major role in keeping us safe, is, I think that kind of is very much a historical kind of thing that certainly, has roots in the post-colonial period.
It's fascinating, and it's also, to bring it back to the United States perspective, it's such a mixed picture, because you could look at the outright rejection of technology in many states in the United States, the rejection of contact tracing apps, the rejection even of the use of a face mask. And you say these people are COVID Luddites. I mean, they just refuse to use the technologies that are available. Right. And yet the president of the United States initiated Operation Warp Speed and this sort of national focus on a vaccine. So there's still a sort of a focus on a techno fix, but it was one that was going to be delivered in a sort of a Manhattan Project mindset rather than one that could be individually utilized. Yoncel, I want to bring you in on this because, well, first of all, just to hear your reaction to what Hallam is talking about, and also bring in the South Korean context around tracing, quarantine enforcement, and the way technology has been used there.
Mm-hmm. Mm-hmm. Yeah, I mean, I have so many points that I want to respond to the questions, and then Hallam's points, and then I have some uneasy feelings with this sort of cultural explanations of why and how East Asian countries in this pandemic have controlled better than Western societies. So that's, I don't know, to me, that's a bit too far-fetched. To say that some country have a Confucius culture, some countries people tend to comply and to the national policies, so that's why it's working. It's sort of, that's a sort of equivalent to American people are rogue, not to follow all the rules. So it's a bit difficult. You need to you want to be very careful in that explanation. But rather, I want to emphasize, like Hallam did, recent experience with the disasters. For example, Hallam mentioned about SARS, South Korea, MERS, Mediterranean syndrome. That MERS was the big one, although it was one of the largest cases outside Middle East. And back then, it was the problem. The problem was that contamination or contagion within the hospital, and the lack of transparency from the part of the government on the information about who's infected and how those people are controlled. So those two parts were forming the great basis of, to my understanding, great basis of today's pandemic control. And also, we often forget about animal diseases. So there's a mouth and foot diseases in South Korea that has been troubling a lot, and AI and many of those animal diseases where South Korea controlled very aggressively. It is very well known for, I don't know what's it's called in English, but they just killed entire farm. If once you find a disease on one there. So it's a very aggressive sort of way of dealing with the infectious diseases in general in both animals and people. So I'd like to emphasize that that was the experience that South Korea had previously that formed today's pandemic response. And regarding that part of MERS being information being not transparent with the case of MERS, South Korea with this COVID-19, they haven't too transparent, sort of. So to control the pandemic, to do the contact tracing. So first, they do have this sort of self-quarantine map. They have GPS-based location tracking on it. And then you have to upload your daily temperature check to that system so that it is directly connected to the health officials who monitors your status. So it's a two-way, is it two-way monitoring or one-way monitoring? But it's a monitoring system based basically from the local health officials of those who are self-quarantining. And also there is a electronic bracelet called safety band introduced for those who violates the self-quarantine rules. So if they don't pick up the phone calls, if they go outside of the designated quarantine spot, they get sanctioned. So they get to have this bracelet, and if you get farther away from the cell phone, or if you try to disable this thing, you get health officials or police coming in, knocking at your door. So that has been introduced to control to the contact tracing. Also, there's a not like Singapore's case, like Safe Entry app. We have this QR code, very simple QR code based registry of every entry of facilities, restaurants, cafes. So basically they collect your phone numbers and time of entry, so that, like Hala mentioned, if there's any case happening, you get the notification that you need to get to be tested, or you need to be self-quarantined. But what I really wanted to discuss is that this use of telecommunication log that is used to do this massive contact tracing 2 times in May and August. So in May, there was an outbreak in the area called Itaewon in Seoul, which is known for bars and restaurants and clubs. And often young people from all over the country gather there over the weekend, and then they spread. So that place had once became the center of disease. So they used this telecommunication log, and they collected nearly, I have a number here, nearly more than 10,000, where is it? 10,000 people's information was given to the public health department. And in August, there was a large anti-President Moon demonstration. It is pretty safe to say they are sort of pro-Trump, pretty similar to politically, and their attitude to virus, COVID-19, is pretty similar to pro-Trump supporters. So they had this big demonstration, and they saw this the case with Itaewon. So they turned off their phones, which ended up still the telecommunication companies were able to collect like 50,000 people's log to the public health officials, but they managed to get away, which became the seed of today's outbreaks. So that kind of turned out to be very effective in tracing pretty much everyone who was there at that time. But at the same time, you raised the concern of how much access should be given to the health authorities. It's you don't really need any consent of giving your telephone logs, things like that. So that kind of shrinks in certain way civil liberty that you freedom of gathering, freedom of do the public demonstration, things like that. That has been sort of tensions between whether public health concerns go ahead, or that expressing political concerns, expressing their democratic values, their democratic democratic duties, sort of, comes first. So, there has been tension that formed around technological use of technology in pandemic control, let's say.
These are all really great points. I just want to remind folks you're listening to COVID Calls. We're talking about the use of technology and COVID-19, particularly in East Asia and Singapore and South Korea. And Yeonsil, to your really excellent point too, that, and I don't want to only blame the media on this, there have been a lot of politicians helping with this as well, but to sort of say, well, because the number of cases has been low, then there's sort of an East Asian culture, which is racist. Obviously, but it goes beyond that too. It flattens the potential for understanding, not just understanding the reaction to the pandemic, but also the ways that the pandemic exposes political tensions that do exist in Singapore and do exist in South Korea, as you were just explaining, Yancel. And Hallam, I want to bring that to you. You published somehow already an article, great piece in East Asian STS with Monami Badra Haynes. And I just want to, it's about the Trace Together app you were talking about. I was going to read a sentence from this.
All right.
You're talking about the way it's, the way people look at it and say, hey, this has been a success. But you also say, nevertheless, opinions about the app expressed online, for example, in comments on Facebook, were sharply divided. Many Singapore residents embraced the app as a critical tool provided by the government for fighting the virus. The app made them feel safe amidst uncertainty. Others were less sanguine, fearing that the app was a mechanism for government surveillance, data valence, or digital spying. And so that taps into a sort of broader discussion just about the way the government in Singapore uses technology.
Yeah, I mean, there's a huge amount to say about this and this kind of tension here. And, I mean, I agree with Yancel completely about this issue of not reducing this to kind of cultural kind of explanations here. But, actually, if we begin to think about what explanations there are, this does, go back to the kind of history, to the politics. And I think that these are more interesting explanations in many kinds of ways. And yeah, I mean, right, we shouldn't, certainly it's not as if, as that, what you just read suggested, it's not as if there's no resistance to these kinds of technologies here at all. And in fact, what has happened in South Korea with the use of the telephone logs and GPS, that has not happened here. In fact, things like the Trace Together app have been explicitly branded as privacy preserving, interestingly, because they don't use GPS. We've been reassured by the government time and time again that they do not tie you to location, right? So they're marketed at least as being much less invasive than following you around, like tracking your phone, basically, which is essentially what I guess is has happened in various places in South Korea, right? So, yeah, I mean, there is a kind of, the government has certainly, and the government wants to push out this technology here, but they're also aware that there are certain kinds of resistances within the Singapore population, and that they need to be kind of responsive to that. And that they can't just that there will be pushback, and there has been pushback. In fact, something like 50,000, I think the number is slightly over 50,000 people signed a petition against making the app mandatory, which was contemplated at one point. And 50,000 doesn't sound like a lot, but in a country where civil society is, I mean, there's only 3.5 million citizens of Singapore anyway, and then civil society is, fairly, curtailed. I would say. I think it's fair to say here. So 50,000 signatures on anything is kind of a lot. So there is some sense that the government has had to respond to kind of push back about these kind of privacy issues and transparency issues, and that they have done that. Whether that is, whether we find that kind of acceptable or a kind of acceptable response, I think is still kind of an open question, I guess, right?
And just to follow up, and I want to ask this of you, Yancel, as well, when people do frame a critique of the use of these kind of technologies, so either if they're directly geolocating people, or if they're basically saying, hey, please participate, and if you don't, we might have to consider additional, more restrictive public health measures. To what extent is the critique of that dip back into history? I mean, to what extent is the critique of that sort of talk about military rule, authoritarianism? I mean, I'm sort of curious about how the counter narrative works, because in the United States, the counter narrative against basically, unfortunately, almost any kind of public health restrictions in many states in the United States has been, I mean, you don't even have to spell out the history. People just say, this is big government once again. But in the United States, in many states, that opens up the Pandora's box, which for many people makes them think about the civil rights era. It brings back the Civil War. I mean, it's sort of any bad thing you want to think about the government, it pops that back into their mind. So politicians in the United States have been very cagey about packaging that dissent.
Mhm.
to bring back up historical cases that they want to leverage. I don't know. Janse, let me ask you about that first, and then Hallam bring you in, because the counter argument against the use of what can be presented as life-saving technology is a space we should be looking at right now to understand this pandemic in a deeper way, I would argue.
Yeah, that's actually pretty difficult question to answer. Many of the counter arguments, interestingly, didn't really bring back the counter arguments I hear does not bring the sort of authoritarian government, the past with the authoritarian government or military control, the possibility of complete control of the civil society by the government. To me, what I hear, what I read, that didn't really brought up. Partially because current administration is democratic, on the side of against authoritarian regime. There's a very strong history over there, strong association over there. But most of the counter argument I hear is the concern over privacy and concern over releasing this information. The sensitive information, it could be sensitive information to those who are exposed their whereabouts in certain days. What I hear is more about that concern.
Okay.
So it's interesting that I don't hear that. To hearing your question, it's interesting that I didn't hear much about that counter narrative. But the concern is that I mentioned earlier is that too much of exposure of information of whereabouts of those who exposed kind of caused sort of risk of outing of LGBTQ communities related to earlier Itaewon outbreak. The Itaewon area is not just the busiest nightlife area, but it is also a site for LGBTQ communities. And one of the clubs were turned out to be gay clubs. So the media went crazy about, and Christian population went crazy about gay people disrupting the public health measures, and the entire social stigma comes in. And Korean community in general is very conservative about homosexuality, gender issues, and then all those stigma comes in to the discourse of public health measures and control and data privacy issues.
Hallam, let me bring you in on this sort of way you're reading the discourse, the sort of government critique discourse there in Singapore.
Yeah, I mean, I think it's in many ways. I think talking to people in the US, colleagues, friends, I often think the problems are sort of often the opposite. We have the opposite problems here that we have in the United States, right? And too little governance, I think, in many places in the United States. We perhaps here in Singapore arguably have sort of too much. And I think one of the ways of relating that to your question, I think, is to say that certainly the idea of big government plays in a totally different way here. Big government is good. Big government is great. Big government brought, Singapore from, as they like to say, sort of fishing village to modern nation, or as Lee Kuan Yew put it, from third world to first in one generation. So big government is, actually this has made Singapore, right? The government, at least by their own accounting, made Singapore into what it is. So, in fact, there is in general, a high level of trust in government. I think that's the baseline from which people are operating. I think some of the narrative, the kind of counter narratives that make people worry about privacy here are actually growing awareness of the problems with social media and kind of corporate data valence, right? That, people are aware that Google is tracking their information about what they buy and what they do online, and Facebook and Twitter and so on, right? And this, I think, there is a kind of a little bit of a growing discourse around, that kind of these kinds of issues, and I think that has now been transferred to worries about what the government is doing with the data that's coming from the pandemic. So I don't think it's in some ways, I don't think it's a direct critique of the government. In some ways, it's a more of something that's been transferred from other worries about data privacy.
Well, Hallam, let me pick up another piece of this. When I had your colleague, your NTU colleague, and friend of mine, Zulfikar Amir, on COVID calls earlier on in the year, and we talked a bit, and he's written a wonderful essay, which is in the Social Science Research Council's disaster studies series that I am co-curating with Alexa Dietrich, and great piece. And he talks about the migrant worker side of this as well. Yeah. So, I mean, you're talking about, we've been talking about Singapore, or I have been talking about Singapore as a monolith, but that's completely incorrect, because it's a diverse society as in social class as well as ethnicity, but also you have this very large migrant worker population, right?
Yeah, I mean, probably this should have come into the conversation earlier, and it's not the way that it went. But yeah, so I should say that almost all of the 58,000 cases that we've had in Singapore have been amongst the migrant workers, something like 90%, something like that. So this happened relatively early. I believe some outbreaks began in the migrant worker dorms as early as March. And partly because of the living conditions in these dorms, people living very close together, crowded conditions, the virus spread very rapidly in those dormitories, and continued to spread rapidly. And this kind of, I mean, I think this has also created, I mean, obviously, I mean, I think like other places, this kind of sort of reiterates the pattern of the most vulnerable members of society really bear the brunt of the risk, and that's absolutely what's happened here. And yeah, I mean, I think one of the responses was kind of, in some sense, panic, and the sense that things had got out of control, at least within the dormitories. The dormitories were sort of closed off pretty quickly, which raised all kinds of other problems. I mean, people were essentially kept, I mean, under lock and key, right? I mean, these became sort of almost like prisons in some sense. But it also created a sense, I think, of panic, and that the government had made a mistake, that they had let some aspect of the pandemic, even though it was amongst a very specific part of the community, that they had not been watchful enough, and that this had, and so I think part of the way the response has developed here is partly to, in some sense, I would say, even make up for that, right? To say, actually, no, look, we've got it under control, right? But in fact, some of the apps and the technology and the restrictive measures, I think, are in fact kind of political demonstration that in fact they maybe that was a mistake, but we now have things under control in Singapore. And to be fair, also they have brought the migrant worker situation under control now. I think there are very few active cases even in the dormitories, and some of those workers are now going back to work. Also, very few of them died, right? So that is also a tribute to the way the healthcare system worked.
That's, to me, of course, that raises the same problem we're looking at in the United States and other places, which is that there's so many ways to read those numbers. But one things we're learning about COVID is that you have the long haul syndrome, right, and then you have other sort of related, disease impacts that are comorbidities that are connected with it, and the mental health aspect of it as well. So in Singapore, does the government express some sort of longer term commitment to the health of migrant workers in the country, or the commitment is only so long as they're living in the dormitory and employed?
Yeah, I mean, this has become a very fraught issue, honestly. I mean, I think there's a general, partly I think that there's pressure from the population again as well, that something needs to change about the way that migrant workers are treated, and the way the dorms operate. I think it's clear that this was already a kind of circulating issue, but it's certainly something COVID has brought to the fore here, and made more urgent. One of the responses, unfortunately, has been to actually suggest that Singapore needs to reduce its dependence on migrant workers. In other words, well, this is too much of a risk. These people are too much of a risk, and so in fact we need to reduce the numbers. I think it's very unlikely that is going to happen, because Singapore depends on them too much in some sense. But I mean, I think that there is a concern that something needs to change here, and I think there are sorts of new rules coming into play about the way in which, I mean, the dorms are privately run; they're not run by the government. So new rules for the dorm operators about how they're supposed to treat people. But this is an evolving conversation. So I think it's yet to be seen what will actually come out of this and whether it will make things better in the long run. I mean, I think it could go either way. In fact, there were even some calls, again, speaking of technology, different type of technology, to put the migrant workers on ships, to have kind of floating dormitories, so they're isolated further from the population.
Further isolated.
Yeah.
And here's the opening. I mean, I've had so much frustration with the national narrative, and I mean, we're having this discussion as a sort of national narrative, but I think we're usefully pushing back on that. And here's what I mean by that, because very similar situation to what you've just described, Hallam, exists in the American Midwest, well, all over the United States, but we've seen it in the American Midwest in meatpacking plants where migrant workers are working. They work off the books there. And this was in the late summer, the center of the pandemic in the United States. And it raised this question, and I really appreciated your answer. It raised this question about, well, I mean, these are just counties in the United States that can't function anymore. And can we really, even these are conservative parts of the United States, can we actually go forward with the idea that the whole meatpacking industry is built on immigrant labor, that we can just turn our back on them when they get sick? And the conversation broke just as you described, interestingly. And so here we're comparing Nebraska and Singapore. Some people said, obviously, we have to bring these people out of the shadows. There has to be a path to documentation. And other people said, this is just too important to the economy of these states. We can't deal with an immigration issue now. We just have to keep these plants running. And the president of the United States issued an executive order saying, keep the factories open. So there you have, I mean, I think this is where we can work really, I think, usefully across international boundaries to expose some of these issues. Jan-Sil, your thoughts on this?
Yes, I mean, it reveals the weakest part of the society here and there, and the pattern, which part is the weakest aspect of the society is a bit different, but it seems like it's fair to say those who are underwaged and frontline workers, often immigrant with weak social security, and South Korea too. It's although it's not reported, I've read a few articles on, South Korea, entire South Korean policy is all about face masking, distributing masks, mandating mask wearing. And then a lot of immigrant workers were not given those public masks early on. So that caused some issue. And although many people in South Korea refuse to see that, South Korean society is in fact very multicultural. There are immigrant, foreign, how do you say, interracial marriages, especially between older Korean male with the younger females from different countries. Also, there are farms, fishing industry, factories. Those are largely supported by immigrant workers, and we are not that open to discuss about their status, what their experience is like in South Korean society. So that's one thing Korean society needs to see more clearly, for certainly. And there is another issue that Scott, you mentioned earlier. It's an overall widening gap of wealth, and certain population is experiencing length of works, 2-3 different jobs, and that had been revealed by this contact tracing policies. So they reveal movement of certain confirmed people with the COVID-19, and then they turned out to be pretty cruel life, their daily life. They have 2-3 jobs, going out 4 a.m., coming back home after midnight. Not just laborers, but those young people who want to enter to, who want to get a job. They tend to hang on this national exams, national teachers exam, national public officer exam. Their life pattern is house library. And that is revealed to the open, I mean, it's cracked open, literally. Yeah. And then everyone is so, a lot of people have been seeing that labor conditions or very harsh living conditions for those younger people, and then those who have low-paying jobs, so to speak. So I would say, yeah. So that's the weak part today's Korean society, I say.
It's amazing to me too that. Well, we're all historians of technology here, so we know what's coming, which is that this data, if it's made available, I mean, imagine the kinds of analysis and narratives that you've both just been talking about as the basis for human rights discussion, as a basis for growth of labor unions, of paths to citizenship, and 100 other policy remedies so we're looking at the pandemic but then we're saying, well, here's a whole nother kind of social ill that's being exposed in the midst of this. And I guess we're going to wrap up here in a second, but I want to sort of give you each a chance to sort of take us out in a longer term for Singapore, South Korea, or Asia more generally. Many of these are countries which, as you said, Hallam, in terms of GDP, household income, has gone from developing to first world in one generation. A finely tuned instrument its economy is to global capitalism. So 28 people have died, and yet you're in an economic recession.
Yeah. I mean,
what's the future look like?
Yeah, I mean, I think there's no really good solution to this at the moment. I mean, I guess the vaccine is the big hope that everybody has, right? That will allow Singapore to open up, right? And to restore its kind of economic, its economic status and be able to open its borders and trade and people coming and going and business and, its hub kind of status. And some of the technology is certainly supposed to contribute to that too, in the absence of a vaccine, certainly. But I guess I wanted maybe to make one other point here, and that is, and maybe this is something that relates to Asia more broadly, even China, that I think that one thing that I see Singapore doing is also using this as a bit of an opportunity, the pandemic as a bit of an opportunity to roll out, and even maybe one might argue test out some of these kinds of technologies for collecting data. And I think of this in particular in the context of what's called here the smart nation, right? Or smart city, the smart city technology. And this is something Singapore is pushing full steam ahead, whether it's digital sensors, digital currency, and these kinds of apps, these kinds of technologies are kind of in some ways perfect ways to kind of trial out some of these kind of imagined at least as future economic kind of generators, right? Innovative kind of technologies that, have perhaps all these privacy and surveillance worries, but are imagined as kind of positive things in the long run. So I think that, there's that kind of aspect of looking towards the future here as well.
Yancel, I want to give you the last word on that. Historians are not supposed to look into the crystal ball, but I'm going to ask you to. And Hallam has raised some really interesting points, because this question about the surveillance society is not a new one. COVID has thrown it into a new light. What's the story for South Korea in that regard?
I don't know. I mean, I would like to, second, what Halam just mentioned, South Korea also devoted to data-driven smart cities, IoT, all that was in the picture of future countries, what the future country will be look like. And then this is going to be a one test bed for, I hate to use the word test bed, but one testing moment for the government on that issue. And then as you mentioned again, South Korea have been already trying to exporting their model of pandemic control, including all sorts of technologies, testing kits, and the contact tracing bracelet. They have been already exported to Saudi Arabia, things like that. They are seeking opportunities here. So I don't know. And then that's on the one hand. And here, society in general is, the wealth gap is increasing, real estate prices skyrocketing. I can't really imagine myself buying a house in the near future. So that kind of thing is happening. So it's a really task should be juggling that two issues at hand for South Korea society in general.
I want to remind everybody you've been listening to COVID Calls, and you can catch COVID Calls every weekday at 5 p.m. Eastern Time. Tomorrow we'll have a pre-Thanksgiving memorial episode with Lori Peak. Will be joining me tomorrow, as well as Ray Foffer, both of whom have been on COVID Calls before, as well as Cecile Sterenberger and other guests as well. So please join me at 5 o'clock tomorrow for that. And I want to thank my guests, COVID Calls regular, Yonsil Kang. Thank you so much for coming back. And Halam Stevens, the Early Morning Award, and hope we can bring you back as well. Thank you both so much for your time today. Just a really interesting conversation.
Thank you.
Yeah, thanks.